right, so we're going to talk about what's called the PEC pattern, or you can just think of the extension pattern. So I want to talk you through this so that you have a good understanding of what we're going to try to do to help reduce your pain and retrain your body. All right, so with that extension pattern, I have my pelvis, I do not have my rib cage, but there will be a video how it pertains to the rib cage. But most importantly, we got to start with the pelvis, because if you're sitting or standing, that's the foundation for the spine. So the extension posture is truly when you're sitting, you're rocked forward a bit. Now, this can be really, really deceiving. A lot of times if we're standing, we feel like that extension pattern should be kind of your butt sticking out. That might not be you. You might feel actually like you've got no butt, like it's flattening, right? And that's called a sway back posture. But you can see me adjust. I'm not going to move my hips. If I bring my hips back under me, I do have that extra curvature, that excess curvature in my low back to where it's really pushing me forward. This is the most common thing that I see, and we've got to break through this pattern before we move on to the next. So here's how you're going to do it. These next series of movements are going to really be focused on bringing you back here. Now, the most important things and what I want to show you is your hamstrings attached right here. Okay, so that's a huge muscle group that we can use to turn your hips back. The glutes, I often see people overutilizing their glutes. Okay, so you're probably doing that, and that's going to, remember, push your hips forward, but it's not going to help you turn them back. The hamstrings are what do that. So as you're going through the exercises, I want you to really check those glutes and make sure you're not squeezing your glutes to try to get these movements. We're really going to focus on where these hamstrings attach. They go from this butt bone down to your knee, where if you're feeling your hamstrings, that's going to be what helps rotate you back. Another big muscle group that's going to really, really impede you from rotating back is your back muscles. So you might feel it, especially if you're someone that when you're, the more work that you're doing around the house, or if you're lifting or something like that, your back gets really tight. It's because these muscles are trying to take over and hold you in a better position. They're trying to help, but they're actually making things worse. So a lot of these positions, we're going to try to relax these back muscles so that you can actually do this. We don't ever want to be fighting against muscle. And it's not really that we're stretching muscle. We work a lot more on facilitating, aka turning muscles on, and then inhibiting or turning muscles off to get the reactions that we want. Because there's no sense in trying to muscle it against your other muscle. You're never going to win, and those things are never going to stick. So that's potentially what you might have tried in the past, which is stretching, especially when you're stretching and holding your breath, because then you just get guarding and co-contraction, or even, strengthening without changing the pelvic position. So again, the purpose of this is we're going to bring the pelvis from a forward position, and we're going to turn it back so that everything stacked on top is going to work really efficiently. That's what we're working for. Efficiency and optimizing your body position makes life in general easier. Okay, so a lot of the movements are going to be about getting these hamstrings to work, turning the glutes off for the moment. We have to do this first, all right, and turning these back muscles off. So we're going to take you from this position and actually overshoot it by tucking you under, breathing and letting the muscles understand what we're trying to do, so that when you walk around, you're in a more neutral position. Again, this is a mistake I see so often, is if you've worked with a therapist before, maybe they see that you're here and they get you neutral. Well, that doesn't work, because then when you get up from the table or you move on with your life, you revert back to this pattern. So we're going to take you all the way here so that then when you stand up and walk throughout your life, you're then in that neutral position. All right, so we're going to gain you motion, tucking, and being able to do that. Now, this brings me to my next point. We don't yet want the abdominals to do this pulling. okay? We just don't want it. It has a lot to do with the rib cage, and you're probably going to use the wrong muscle. So we're not going to think about doing a crunch under or a lift, okay? Again, the hamstrings are going to be the main thing that we're going to get woken up here. You do have an underlying deep core muscle that I'll tell you about real quick here, because you might hear me cue or ask you to use it throughout some of these motions. Is you have a muscle that pretty much, we can just think about it connecting front hip point to front hip point, these pokey parts in the front, and you're going to imagine, okay, the muscle you actually want to activate is the muscle that you can imagine pulls those hip points together. So if you can do that with me as you're listening to this, you can find your front hip points and you can think about what muscle, what can I use to pull those hip points together. Now, you're not going to get a whole lot of movement from that because it's a supporting muscle, but you are going to feel your deep abdominals work. And that is the most important abdominal muscle you want to have on cue. It's not going to turn on very readily until we get the hamstrings. So hamstrings first, it'll turn you back under so that you're in neutral. And then I might cue this muscle here between these hip bones to bring together. All right, so the next series of exercises, that's the purpose. And I want you to understand that so that way in your daily life, you're not working against yourself by, having that posture. One more point here I just want to make. This is really important for those of you that feel that your hips are more forward in respect to your ankles. Is one other thing that's really going to trip you up is if your knees are hyperextended and your hips are forward, all the force is jamming up your back. So we've got to bring you back. So what that means is you're going to practice standing with your knees slightly bent, and you're going to find your heels really sturdy into the floor. And that's what's going to help you actually feel better positioned. So you'll also see in a lot of the videos, I'll cue soft knees, find your heels. And that's